Hello and namaste to you all. This is Sulekha Shrestha from Sulekha Hospital as a nursing supervisor. Today I am going to present a research study on good compliance with surgical antibiotic prophylaxis, but more to be done in a referral hospital in Nepal. So non-compliance to surgical antibiotic prophylaxis, SAP, guidelines risk negative patient outcome and antimicrobial resistance. So with the purpose to measure the compliance with SAP guidelines, we selected 846 patients who underwent surgery in a Department of General Surgery at Sulekha Hospital during July to December 2019. We selected retrospective cohort study design, and we collected data from operating theater records, medical records, and surgical site infection surveillance records from the hospital. So here are some of our findings. So we found that 75% of patients who were undergoing surgery, they had a overall compliance in our study. Similarly, half of the patients who were not eligible for SAP, they received the initial dose of the antibiotics in our study. And we found that National Antibiotic Treatment Guideline, it lacks the specification for SAP on the choice and doses of the antibiotics. So here we are talking about the evidence, implications, and recommendation of our study. So our first finding, overall compliance of SAP was 75%. So this is a high percentage. However, there are some remaining gaps. And half of the patient in our study who received the initial dose of antibiotics, they were not eligible for it. So this is the evidence of irrational use of antibiotics. Here, we would like to recommend our hospital management committee to establish an antibiotic stewardship program and also to develop a hospital level protocol based on National Antibiotic Treatment Guideline. So in our another evidence that National Antibiotic Treatment Guideline, it lacks the specification for the choice and doses of antibiotic for SAP. So this may create a variation in clinical practices between the clinicians, and it also may lead to the inappropriate prescribing. Here we would like to recommend the AMR multi-sectoral steering committee to support the further researches on SAP compliance in other hospital settings in Nepal. We also would like to recommend to advocate for the revision of National Antibiotic Treatment Guidelines. So I would like to conclude my presentation with the message that compliance to surgical antibiotic prophylaxis guideline is critical to ensure the appropriate antibiotic administration and to reduce the risk of AMR. Thank you very much. If you are interested in our paper, you can visit this site. And I would like to thank all of the supporters mentioned in this slide. Thank you very much.